Now let us have a discussion of gastric adenocarcinoma. As the name suggests, it is a carcinoma of GI tract, and this carcinoma arises from epithelial tissue. As you know, the main risk factor for most of the gastric ulcer, carcinoma, these are Helicobacter pylori. This is a bacteria that causes, that is a notorious bacteria that causes this kind of conditions. Also, chronic gastritis may lead to gastric adenocarcinoma. Now, histologically, gastric adenocarcinoma can be classified into two types: intestinal type and diffuse type. And this classification is known as Lorentz classification. So according to Lorentz classification, gastric adenocarcinoma is divided into intestinal type and diffuse type. In intestinal type of gastric adenocarcinoma, you can see gland formation. If you see histological slide of intestine or stomach, you can see glands. In this carcinoma, you can see more of these glands. So gland formation can be seen in intestinal type of gastric adenocarcinoma, and the main cause of intestinal type of gastric adenocarcinoma is H. pylori infection or Helicobacter pylori infection. But in case of diffuse type is mainly familial. It mainly originate because of genetic mutation. CDH gene mutation is the main reason for this. What happens if CDH1 gene is mutated? It causes absence or less formation of E-cadherin. As we know, E-cadherin helps to adhere epithelial cells together. So if there is no E-cadherin, there are poorly cohesive cells in the histological slide of diffuse adenocarcinoma. And these are mucin forming cells. There are too much mucin, and due to accumulation of intracellular mucin, we can see signet ring cells in this diffuse adenocarcinoma. If you talk about clinical presentation of diffuse adenocarcinoma, then it is not diffuse adenocarcinoma, gastric adenocarcinoma. It is often asymptomatic at early stages. There are few vague symptoms like nausea, early satiety, dyspepsia, but most of the symptoms are very vague and they do not directly indicate to the gastric adenocarcinoma. At advanced stage of gastric adenocarcinoma, we can see metastasis. Umbilical metastasis is known as Sister Mary Joseph nodule. Due to umbilical metastasis, we can see Sister Mary Joseph nodule. And due to left supraclavicular lymph node metastasis, it is known as Virchow's node.